Dr. Cohen. I hope you're having a good Monday so far. I just want to say again, I appreciate you taking the time to listen to my presentation today, and really, I appreciate your patience with me really all this semester. It means a lot to me. So the purpose of my literature review was to find evidence-based practice to support my own research question, which is, can music therapy reduce the risk of toxic stress in hospitalized children and young adults? So first, I want to talk about the causes of cancer-related stress in children and young adults. This includes, the shock of the diagnosis, along with diagnostic testing, frequent appointments, and ongoing treatments. All of these can really have a psychological impact on a child, including depression, sleep disturbances, fatigue, and anxiety. And then we look at the hospital environment. And the hospital environment is stressful because it is often chaotic, inconsistent, unfamiliar, unpredictable. It challenges a child's sense of competence. It fails to challenge an individual to act, and it fails to communicate clear expectations. This can have a negative effect on the child's development and or family functioning. So then the long-term effects of stress. Often stress is experienced without adequate support. It can cause disruptions in brain structure development and can cause a lowered ability to manage stress, and also negatively affect other organ systems in the body. So then we look at ACEs, so childhood adversity and high levels of stress at a young age and the consequences of that. So high levels of stress and childhood adversity is associated with a wide range of negative behavioral and neurodevelopmental consequences. It can cause issues later in life, and often these children experience trauma, and they may need additional emotional support now and later in life. So why music-based interventions? They're designed to diminish the negative effects of hospitalization. They understand how development plays a role in coping. They create a more supportive environment through the use of the music. And they could be an effective tool in meeting the needs of patients during their time in the hospital. Music therapy interventions can motivate the child to be active participants in their own environment, and it provides the child with structure, autonomy, support, and involvement, which is the core purpose of the contextual support model, which is what I'll talk about next. So the contextual support model aims to buffer the effects of stress, reduce psychological distress, re-engage children with their environment, use music to provide the autonomy, structure, and support that I had just mentioned. It is a working model that offers ideas regarding the function of music to promote coping, and it is based on a synthesis of current research in coping, child development, and music therapy. So the contextual support model first looks at music and structure. Music and structure serves to diminish the effects of chaotic environments. It provides order and predictability to a child. It fosters feelings of security and enables children to re-engage with their environment. And then music and autonomy support encourages freedom of expression, allows child to make choices and decisions for themselves. It encourages independence, and the flexible musical structure allows for creativity. And then we look at music and involvement. And music and involvement mitigates the effects of a neglectful environment. It builds a child's sense of security and self-worth. It supports the child in times of distress. It promotes interaction between children and family members, and even child and staff, and child and therapists. And it creates an emotionally positive environment for the child. Okay, now we will look at clinical outcomes of music therapy in hospital settings. So looking at some of the studies that I reviewed, the effects of music therapy and guided visual imagery on chemotherapy-induced nausea and vomiting. In this study, trait anxiety levels decreased significantly and reduced severity and duration of chemo-induced nausea and vomiting significantly. And music therapy also had positive effects on chemo-induced anxiety, nausea, and vomiting. The effects of music therapy for patients with advanced disease. Patients in this study had a positive response to the music therapy. The music therapy had a significant effect on symptoms of chronic pain, anxiety, depression, shortness of breath, and music. It was determined that music has the ability to communicate in a way that transcends language. Music is capable of transforming and moving individuals on an even deeper level, emotionally and spiritually. A national clinical practice review of music therapy suggests that pediatric patients and their families need more positive experiences that offer a sense of normalcy and control in an often chaotic environment. I also looked at parents' perspectives. A qualitative study reveals that music therapy was generally perceived to provide a nurturing environment for children, and communication with therapists was experienced as mostly helpful. Parents perceive positive outcomes of music therapy, including children becoming calmer and children engaging more with musical activities in the hospital and at home. The conclusion, current research that I found suggests that distress is significant in hospitalized children. Hospitalized children need as much support provided to them as possible. Music therapy could be a useful tool for the prevention of toxic stress that is experienced by many hospitalized children and young adults. Music therapy interventions could have the ability to reduce adverse childhood experiences for these children, and music therapy could aid in providing hospitalized children with a fair chance for a healthy and successful future. So an important future research question to ask is, to what extent might family-based music therapy interventions influence the family member's stress levels while their loved one is in the hospital? This is a quantitative study, and the method that I would use would be to collect data using a 5-question Likert scale, and then comparing that data. So the experimental group would receive the music therapy interventions before the data was collected, and the control group would receive the music therapy interventions after the data was collected, and then reevaluated after receiving interventions to see if there was any changes in that data. And that is it. And I appreciate you so much, and I hope that you have a wonderful, happy, healthy, and safe holiday. Thank you so much, Dr. Cohen. Merry Christmas.